everybody. Welcome to MedPod Today, the podcast series where MedPage Today reporters share deeper insight into the week's biggest healthcare stories. I'm your host, Rachel Robertson. I'll start off the episode today by telling you about how public health groups across the country are collaboratively monitoring infectious disease threats for the World Cup. Then, Shannon Firth will talk about yet another clash between a physician group and private equity. Lastly, Christina Fiore will run through how MedPage Today broke the news about ADA kicking out 5 diabetes researchers from their annual conference and the chaos that ensued after.
The FIFA World Cup is in full swing, bringing millions of soccer or football fans from around the world to North American stadiums. As with any mass gathering event, risk of disease spread is heightened, with people from around the globe mingling. A collaborative of public health groups are working together to track infectious disease threats during the World Cup. Reporter Rachel Robertson is here to tell us more. Rachel, who is leading this collaboration?
Efforts are being coordinated by the Health Security Operations Center, or HSOC, which is a project of Georgetown University's National Center for Health Security and Resilience in partnership with MedStar Health. But there are more than 30 collaborators, like wastewater monitoring and health tech companies, epidemiologists, and science communicators like Caitlin Jettalina of Your Local Epidemiologist. Rebecca Katz is the director of HSOC, and she told me that when it comes to major global events like this, the onus to prepare for public health threats and conduct monitoring usually falls on the host country. Indeed, the CDC is coordinating with host cities and conducting surveillance. However, America's public health infrastructure has been gutted in recent years, and the Trump administration removed the U.S. from the World Health Organization earlier this year. So this independent collaborative is stepping up. Katz told me that, quote, "This is really the first time we're trying this to see how a non-governmental entity can work independently but in support of all of these efforts."
What exactly is HSOC and collaborators doing to track public health threats?
There's a big network of data collection and analysis, from social listening to wastewater surveillance. It all funnels towards HSOC as central command. HSOC is sending out daily situation reports to a list of more than 1,000 government officials, associations, and emergency managers at hospital systems. FIFA, who runs the World Cup, is not an official partner, but it's on the distribution list. The role of HSOC is to detect and prevent the spread of disease, to escalate concerning information, and then trigger a public health response early if threats arise. Basically, they're helping decision makers get a clearer picture of what pathogens are spreading as soon as possible. And by the way, HSOC has a tiny budget, and most collaborators are contributing using their own resources, which isn't necessarily sustainable in the long run. Depending on how things go, they'd like to keep it up for the LA Olympics in 2028.
Tell us more about wastewater surveillance and how it's useful during the World Cup.
For sure. Wastewater surveillance is being utilized by several HSOC collaborators, and this technology became pretty popular during COVID, but the basic version has been around for decades. The gist is that wastewater samples are collected and analyzed for either specific pathogens via PCR test or with metagenomic sequencing, which can catch a wider web of pathogens by analyzing all the genetic material in a sample. PCR has like a 48-hour turnaround time, and metagenomic sequencing is more like a week because it takes longer to analyze all of that. Several experts compared wastewater surveillance to weather radar, where it kind of gives you a sense of what is circulating, when, and where. There are hundreds of collection sites across the country. While scarier pathogens like hantavirus and Ebola are still making headlines, HSOC doesn't anticipate those being an issue during the tournament, but the surveillance systems would pick them up if they did. Measles, norovirus, and the flu are all more likely to pop up. In a sense, the World Cup is kind of a bellwether for mass wastewater surveillance, and we'll be paying attention to what kind of signals the testing picks up.
We'll be interested in hearing about those. Thanks so much, Rachel.
Thanks, Christina. I'll take the host seat from here. A group of emergency physicians were blindsided when the hospital system they worked with announced plans to end their contract and partner instead with a private equity-owned practice management company. Shannon Firth is here with the story. Shannon, start from the beginning. What happened?
So, Rachel, there's a physician-led group called EMBER, or Emergency Medicine of Blue Ridge. It's an independent democratic group where physicians have a voice in shaping patient care, or so they've told me. Technically, the group only formed 2 years ago, but the 6 groups that consolidated to form Ember actually have been around for about 25 years. On the morning of April 2nd, Ember's president, David Watts, gets called into an emergency meeting with Valley Health. Now, Valley is the health system that Ember partners with in West Virginia and Virginia. Valley tells Watts that there's a clause in their contract that lets Valley terminate Ember without cause if Valley gives them 6 months' notice. So come September 30th, Ember is out and private equity-owned group's SCP Health is in. And if Ember physicians and their advanced practice colleagues want to keep working for Valley, they can work for SCP Health. Ember employees are then told the broad strokes of their contract, and that is that they would become 1099 employees. They'd lose insurance and retirement benefits. They would have malpractice insurance, but they'd take a pay cut and basically become independent contractors. Even more concerning, according to the doctors I spoke with, is that SCP Health planned to cut physician staffing from 90 physician hours per day to 70, and then double the number of hours per day for advanced practice providers from 30 to 60. One Ember physician told me that was a kick in the teeth.
What happened next?
So Watts set up a meeting with the American Academy of Emergency Medicine, who recently helped another group of emergency physicians deal with a similar situation in Oregon. In that case, the Eugene emergency physicians sued their employer and the private equity firm that was trying to displace them. While technically the lawsuit settled and there was no winning verdict, the employer actually backpedaled and the Eugene emergency physicians kept their jobs. So effectively, the physicians won. So AAEM writes a letter to Valley's board of directors, and they highlight the importance of physicians having control over not only bedside care decisions, but hiring, firing, and staffing. In terms of fighting Valley's actions, the first problem was the law. 2 of Valley's health hospitals are in West Virginia, which has some protections against the corporate practice of medicine. The other 4 are in Virginia, which has none. The second problem was money. Even a short legal action can cost hundreds of thousands of dollars, which can be particularly frightening for younger physicians who are just paying off their medical debts, starting to build families, and trying to buy homes. The third obstacle was time. In the 2 months that passed since Valley Health held that emergency meeting, some Ember staff have actually found other jobs and put their homes on the market. Ember estimates that about a quarter of their full-time staff plan to stay and work at Valley Health under this current plan. So even if Ember filed a lawsuit and won back their contract, they would no longer be able to staff these hospitals.
So what will the doctors you spoke with do now?
So one Ember leader told me he'll probably retire a few years early. He wants to give back, maybe work for an underserved community. But for now, he's lobbying Congress and state lawmakers to help craft a bill to put stronger protections in place for independent physicians, so that what happened to Ember doesn't happen to other doctors. Another Ember doctor told me he's still undecided. He doesn't want to uproot his family, but he knows he has to put food on the table somehow. So he'll take the summer to decide what to do next.
Thanks, Shannon.
Thanks, Rachel.
Five diabetes experts were kicked out of their society's annual meeting in New Orleans earlier this month. Their offense? Handing out copies of an editorial published in the society's flagship journal. MedPage Today broke that story, and Christina Fiore is here to tell us about how it all unfolded. Christina, take us back to Friday, June 5th at the American Diabetes Association meeting in New Orleans. What happened?
Sure. So our endocrinology reporter, Kristen Monaco, was attending the meeting, and she was outside of this keynote session where NIH Director Jay Bhattacharya was initially supposed to speak. Now, he ended up canceling at the last minute, but he sent a deputy instead. Several diabetes experts were outside of the hall handing out copies of an editorial published in Diabetes Care, which is the flagship journal of the American Diabetes Association. One of those experts was Dr. Stephen Kahn, who is actually the editor-in-chief of that journal and the lead author on that editorial. It criticizes the Trump administration's changes to federal funding and the impact on diabetes research. Kristen told me that within about 10 minutes of them handing out the editorials, convention center security began asking them to leave. Now, security is backed up by local and Louisiana state police. Kristen's reporting instincts kicked in and she started recording. So her video shows one of the officers shoving one of the researchers, and it also shows meeting security ripping the stack of editorials out of Kahn's hands. Next, the researchers are escorted out of the building and they're asked to hand in their badges. And we quickly wrote a story and published the video, and we sent everything out as a breaking news alert. And not long after that, a lot of other outlets had picked up the story and it broke pretty big.
Did those researchers end up getting their badges back?
No, they didn't. So the ADA sent out an email response by the end of the next day, Saturday, June 6th. And after that, Kahn said they were offered their badges back, but he said there was no apology and no attempt to bring everyone back together to talk about what happened. So all 5 of the experts who were kicked out declined the offer to return. Now, one of them did pick up his badge, but just as a memento of what had happened at the meeting.
Mm-hmm. Was there any other fallout during the meeting?
There was. So at least 2 ADA leaders resigned. President-elect Jennifer Green and Scientific Sessions Planning Committee Chair Mark Atkinson, they both gave up their positions with the ADA. Sources said the resignations were, in fact, in protest of the ADA's actions. There was also a walkout by dozens of attendees during the presidential keynote session on Sunday morning. They held a banner that said, "We stand with science." There was a Change.org petition started by renowned diabetes expert David Nathan that garnered thousands of signatures. And another very well-known diabetes expert, Dr. John Buse, made a statement during a session that he chaired that Kahn was supposed to speak at. Buse noted that there were, quote, no protests, no speeches, no placards, no bullhorns. He called on attendees to applaud Kahn's standing up for science, and that prompted a standing ovation.
Did the ADA ever apologize?
Yeah, so after the meeting ended, the ADA's CEO issued a video apology saying he was, quote, deeply sorry for the hurt, frustration, and the pain that resulted. Kahn said that he was very pleased to see the ADA, quote, recognizes that they erred, and this is a good start to healing. I think a lot of physicians and researchers were just stunned that their colleagues could be kicked out of a meeting for handing out copies of an editorial published in a scientific journal, and in this case, the organization's flagship journal. We asked in our weekly survey if ADA was justified in kicking out the 5 attendees, and 95% of more than 300 respondents said no. And sadly, I think many people have come to expect something like this to happen, given the political attacks on science in the past year and a half.
I'm sure you will let us know if there's any more fallout from this story. Thanks so much, Christina.
We definitely will. Thanks, Rachel.
And now a quick measles update before we go. Last week, there were 32 new measles cases. However, the World Cup just began, and nearly half of the 48 participating nations have active measles spread in their home country. The week before, there were 56 new cases. Most of the cases in the past 2 weeks were in Virginia and Pennsylvania. To see the interactive breakdown of measles spread, check out our measles map, which is updated at the top of each week. And that is it for today. If you like what you heard, leave us a review wherever you listen to podcasts and hit subscribe if you haven't already. See you again soon. This episode was hosted and produced by me, Rachel Robertson. Sound engineering by Greg Laub. Theme music by Palomar. Our guests were MedPage Today reporters Rachel Robertson, Shannon Firth, and Christina Fiore. Links to their stories are in the show notes. MedPod Today is a production of MedPage Today. For more information about the show, check out medpagetoday.com/podcasts.